Kuzampo and welcome to Tunsu BVS. I'm Mishi Chodin, your host, and today's topic is suicide, a preventable loss. Death by suicide is among the top 6 causes of death in Bhutan. Productive age group between 15 to 40 contributes the most to it. The increasing number of suicide is contradictory for a nation famed for its peace and gross national happiness. Suicide is an unfortunate loss which can be prevented through united effort. Now let's get to know more about the subject with a leading psychiatrist. Please welcome Dr. Nirula. Welcome to the show, Doctor. First of all, thank you so much for taking out the time, La. The first question would be, what is suicide, La?
Suicide is an act of taking one's own life.
What are the causes of suicide, the major ones?
The major causes of suicide are obviously the number one is mental disorder. Like in mental disorder, there are different disorders, but depression becomes number one. Mm-hmm. And then along with that, anxiety, bipolar affective disorder, schizophrenia, all can cause suicide, all can lead to suicide. Some traumatic experiences, especially during childhood, maybe physical abuse or sexual abuse, can also prompt somebody to take their own life. Bullying in school or in institutions can be a major cause. Personality disorder, generally people who are more borderline type of personality disorder can sometimes harm themselves, which leads to death. Substance use and alcohol are very prominent things that we have seen even when we did that survey. Unemployment, relationship issues, genetic predispositions, like if there is a relative who had died due to suicide in the past, for example, from the father's side, from the mother's side, so there will be a strong gene for that, so people can succumb to suicide. Social isolation, many times people are just isolated, no family support, all that thing can lead to suicide. Terminal illness is another thing. Like when sometimes due to terminal illnesses, people can have some sort of a philosophical desire just to they have the desire to ease the problem of other family members. So they think that other family members are burdened with their illness, so they might think of taking their own life. Okay. So these are some of the things.
Okay. The next question would be, what are the risk factors and symptoms or warning signs of suicide?
Okay, the risk factors for suicide vary by age actually. Mm-hmm. And different ethnic groups. So 90% of people actually have a clinical depression. So that is definitely, if there is depression, we have to be on the watch out for any suicidal act. So we have to be in that one. Any type of mental disorder, like I said, anxiety, bipolar affective disorder, or schizophrenia, all these things can lead. And then another thing is chronic alcohol problem or substance use problem. These are some of the things. And then the risk factors actually include if there was previous attempt of suicide. So many times if there was an attempt in the past, we have to be very cautious, because many times people may have tried several times. Like few occasions we have seen that people have tried at least 4 or 5 times before actually they died due to suicide. So we have to be on the watch out. If there is a family history of mental disorder or suicide in the family, we have to take that. If there was a history of suicide among the family, if there is a history of violence among the family members, if there is any firearm in the house, for example. Like in many Western culture, they keep firearms, but in our culture, I think firearms is not a very common thing. But we do have access to a lot of other mode of suicide. For example, in our case, we have seen many people dying due to hanging. So for hanging, you actually don't need any firearms. So you could get access to any type of rope or any type of a belt or whatever. So all these things can actually be a thing. So chronic illness, physical illness, like where there is a lot of pain, or it may be a cancer which sometimes is incurable, all that things can do that. And incarceration, meaning somebody who has been sort of locked up from the society. in a jail setting. So that is another thing. And if there is an exposure to suicidal behavior of other people, so people just copy, or so there's a, we call it copycat behavior. So there are you also asked me about the suicidal warning signs, right?
Yeah,
So
symptoms of
suicidal
warning
warning signs like thinking or talking about death is one. Clinical depression. Sometimes many people just withdraw themselves and they don't express much, and they may not even seek help. So that is another problem. Now, having a death wish, like my life is not worth it, or that sort of a thing, so that can lead to suicide. Losing interest in day-to-day activities, or that you used to like actually in the past. Making comments about being hopeless, helpless, being philosophical sometimes. Putting affairs in order. Sometimes people just put everything, like the thumb and all is handed over to somebody, the land is divided, everything, so that sort of a thing, no?
Yeah.
So that,
Tying up the loose
tying
ends.
up all those, so these are called tying up loose ends. So sometimes even changing a will, things like that. And saying like, it would be better if I wasn't here, or I want out of this situation, that sort of a thing. Sometimes mood swings, no? They're depressed and suddenly they seem to suddenly enlighten, or they seem to have
Dramatic
that
change in
behavior,
mood.
dramatic change in their mood. Talking about suicide or killing oneself, visiting or calling people and saying goodbye. So these are some of the warning signs. And then warning signs, whenever there are warning signs about suicide, I think every one of us has to be alert. We have to provide whatever support we can. We have to accept that person without being judgmental.
Yeah. First, we have to recognize all the risk factors.
Right.
After recognizing all the risk factors, so you have to look out for the warning signs.
Correct.
The warning signs will be reflected either in verbal, emotional, or behavioral. If you can track down any of these warning signs, you have to immediately get help or help that person.
Right.
Okay. Which age group is vulnerable to suicide now?
Now, if you look at the world figure, I think if you read about literature and all, you'll see that mostly people of the older age are the ones who commit or die due to suicide. But the fact is, like in our case, like we did a study in the past, and we have found out that most of the people who died due to suicide belong to age group between 25 and 45. So that's fairly a very productive age group, right?
Yeah, that
so having said that, I think suicide can happen in any age group.
Yeah, so basically no one is immune.
Nobody is immune to it.
Yeah.
So we have seen people as young as 11 years dying due to suicide. So that means there are occasions when people just do something that is undesirable.
How to cope up with suicidal thoughts now?
Okay, there are different strategies actually. So step one is promise not to do anything right now. Basically, whenever you have that suicidal thoughts, I think it's no, I have to do something different. So promise not to do anything. And then two is to avoid alcohol and drug, because we have seen that there's a very strong association between the act of suicide when somebody is under the influence of alcohol or drug, because that gives them a courage, that numbs their mind, and then they can commit suicide. So alcohol, and avoid drug and alcohol. Make your home safe, meaning like we have already talked about those modes of suicide. So if there is insecticide or any type of poison in the home, that should be removed immediately. You have to consciously do that. If there is firearm, you have to take care of that. If there are any means that you might actually
any
use
threat.
it, any threat, so that all that thing has to be taken out. And don't keep suicidal feelings to yourself. Many times, I think in our culture, we just keep things pent up inside us. We don't express much. So I think it's high time that we start expressing ourselves. We express it to anybody that you feel comfortable with. I think that's very important. Take hope. People sometimes get through all these things. So it's not the end. So we have to do that.
What sorts of services are available in our country for those who feel suicidal now?
Well, first of all, we have now started suicide prevention program in the Ministry of Health. Of course, they don't have any direct contact with that, but they are trying to educate lots of people in order to help people who are suicidal or who try to seek help. But psychiatric services, even though available only at JDW, we have been able to provide training to all the doctors in the district. So they should be able to provide some help. All medical doctors actually are trained now. So psychiatrists in JDW, we are 3 of us, and we have one other psychiatrist in the army. So we are of help. Now we are training a set of counselors, mental health counselors. They are going to be actively involved in counseling and all. We have got something called mental health focal persons in these districts. So we have identified some nurses or health workers, and we have provided extra training in order to sort of manage a crisis. So they can respond immediately and they can provide help as and when it is needed. And then there are Renew volunteers who actually deal with the domestic violence cases, but then they also are people who are trained in some basic counseling. So these are the ones who can provide psychological support, especially people who are victim to domestic violence. We have this youth development fund, which was trying to sort of create a group of young volunteers, peer volunteers, who can actually intervene in people who are suicidal or who have this type of crisis situation. There is a Department of Youth and Sports under the Ministry of Education, which has, again, a very good set of counselors. Now we have counselors in schools, full-time counselors, not the teachers, but then there are full-time counselors who are also provided with good training, and there are some. And we have Health Help Center in Thimphu, the 112. That is one where almost all the people who are manning that Health Help Center have been now trained, and we can provide fairly good psychological services, doctors, nurses, any type of people. The only thing is we want people to come forth so that we can provide that help. The only worry that I have seen is people are not coming forth.
What to do if you feel that someone you know is suicidal?
Okay, one thing that we need to do is, because sometimes we start lecturing, or we do a lot of things.
Yeah, we do that.
So basically, first of all, be yourself.
Okay.
So let the person know that he or she is not alone. That is very important. You have to use the right words at the right place. You just be there, basically. You listen to them, because they may have a story to tell you. There may be a reason there.
Definitely.
Okay, so that is very important. And then we have to be sympathetic as well as empathetic, because we can be in their position. So we have to be very careful about that. We need to offer hope, but then sometimes don't offer false hope. And then take the person seriously. That is very important. Now, there are a few things that we don't do, actually. One thing is don't argue. Don't argue with a suicidal person. That's not going to. So we sometimes tend to say, oh, you look at your family, look at the other side, you are so rich, all that thing. It doesn't make any sense to them at that moment of time. Then don't act shocked and start lecturing. That's not going to help. Don't promise that you are going to keep everything secret, because many times, oh, don't tell my parents, don't tell this. That's not going to help, because sometimes we may have to, because your law may not allow that. You may, or you might have to seek help of other people in the person's family, because you are not going to take care of that person throughout your life. So that support needs to be there. So in order for that, don't ever promise that you'll keep everything confidential. Okay? Don't offer ways to fix their problem, because they are depressed. They have a different psychological setup there. So by trying to offer ways to fix their problem is not going to do anything. And don't blame yourself, like, oh, sorry, I cannot help you, or that sort of a thing. That's not going to help.
What could be the possible reason for increase in suicide number in Bathinda?
The life has become very competitive now.
Definitely.
And many people have started leaving the rural areas, and they want to survive in an urban setting, because that is what they have seen. And so sometimes educational failure can make them sort of feel helpless, hopeless. So that a failure in education. Then another is like unemployment. I think is driving a lot of people into anxiety and depression. So that can obviously lead to suicidal act. More and more people are getting anxiety and depression. I think because we have sort of migrated from the old very spiritual society to a very materialistic society where everybody wants to have something or the other because you are copying from others. You want to have that which other people seem to have, and then you are struggling sometimes. So when you cannot achieve all those things, you tend to feel that you are hopeless or you are not a success. So that could be one reason. And I think our social values are, our belief system, social values are not going too well, because we, even though we are a Buddhist country, many times now we don't, our young people don't seem to actually accept those philosophical things. So I think that's one reason.
Why do you think it's not very common to receive the reports of suicide attempts in Bhutan?
I think one thing is like criminalizing. Like whenever somebody attempts suicide or has died of suicide, like people think that they are criminals. Okay, so that I think prevents people from sort of reporting that. Another thing is like the stigma that is attached to suicide or any type of mental illness. I think that is these are the two things. Now, when it comes to criminalization, until recently, I think even the penal code of Bhutan sort of was punishing people who were trying to commit suicide or take their life by suicide. So I don't know whether it has changed. I have not revisited the penal code, but it was. But I was assured by the Royal Bhutan Police that they don't criminalize anymore. So that is a good thing. So if there is, if somebody has attempted suicide, I mean, they cannot be punished again, isn't it? I mean, of course, like there are many countries in the world where somebody attempts suicide and they are imprisoned for doing that. So at least that's not there. So I think stigma is a big issue. So I think we have to address that a lot.
So people need to understand that mental illness is like any other illness. The symptoms and everything, it's like, it's very normal.
It's very normal. Okay. But the problem is like when it comes to stigma, I've seen that actually the more educated somebody is, they feel more stigmatized actually. They don't like to see a psychiatrist because they think that visiting a psychiatrist means you should be mad. Now we have been trying to convey this message several times. Every time we come to the BVS, every time we are in the Dungso program, I keep on repeating the same thing. The less educated people take a psychiatrist as any other specialist. They have no problem seeing a psychiatrist. They think that we can fix some of their problems. But the thing is, educated people, they always have some sort of a skepticism to visit a psychiatrist or a mental health professional. So I think we still have a long way to go. I think it's not only in our country, even like I was told by some of the colleagues who volunteer with us that even in the United States, where people are supposed to be well educated, everybody is sort of open up to the new world, still they also have stigma.
Amitriptyline. Common side effects are dry mouth, trouble seeing, low blood pressure on standing, sleepiness, and constipation. Serious side effects include seizures and increased risk of suicide in those below 25 years of age, urinary retention, glaucoma, and a number of heart issues. Usage of amitriptyline during pregnancy is not advisable as it may cause problems. Fluoxetine. Common side effects include trouble sleeping, loss of appetite, dry mouth, rash, and abnormal dreams. Serious side effects include serotonin syndrome, characterized by high body temperature, agitation, increased reflexes, tremor, sweating, dilated pupil, and diarrhea. Mania, also known as hyperactivity, seizures, and increased risk of suicidal behavior in people under 25 years of age, and an increased risk of bleeding. Withdrawal symptom. If stopped suddenly, may experience anxiety, dizziness, and changes in sensation. Lithium. Common side effects. Hand tremor. If tremors are particularly bothersome, and additional medication can help. Increased thirst, increased urination, diarrhea, vomiting, weight gain, impaired memory, poor concentration, drowsiness, muscle weakness, hair loss, acne, decreased thyroid function, which can be treated with thyroid hormone. Risk can cause certain birth defects and should be used with caution in pregnant women, especially during first 3 months of pregnancy. Breastfeeding isn't recommended if you are taking lithium. Long-term lithium treatment can interfere with kidney function or lead to permanent kidney damage, which is why periodic monitoring of blood tests to measure kidney functioning is important. Sodium valproate. Common side effects include nausea, vomiting, sleepiness, and dry mouth. Serious side effects include liver problems, so regular monitoring of liver function tests is therefore recommended. Risks: pancreatitis, which means inflammation of pancreas, and an increased suicide risk. It's also known to cause serious abnormalities in baby if taken during pregnancy. It is not recommended for women of childbearing age who have migraines. Carbamazepine. Carbamazepine is an anticonvulsant. It works by decreasing nerve impulses that cause seizures and pain. Common side effects include nausea and drowsiness. Serious side effects include skin rashes, decreased bone marrow function, suicidal thoughts, or confusion. Risk: it should not be used in those with a history of bone marrow problems. Usage during pregnancy may cause harm to the baby. However, stopping it in pregnant women with seizures is not recommended. It is not recommended during breastfeeding. Care should be taken in those with kidney or liver problem. Antipsychotic, risperidone and olanzapine. Risperidone. Common side effects include movement problems, sleepiness, trouble seeing, constipation, and increased weight. Serious side effects include the potentially permanent movement disorder, as well as neuroleptic Mallagen syndrome, which is characterized by fever, altered mental status, muscle rigidity, and autonomic dysfunction. An increased risk of suicide and high blood sugar levels are also experienced. Risk: in older people with psychosis as a result of dementia, it may increase the risk of dying. Olanzapine. Common side effects include back pain, constipation, cough, diarrhea, dizziness, drowsiness, dry mouth, headache, increased appetite, lightheadedness, nausea, pain, redness or swelling at the injection site, sore throat, stuffy nose, tiredness, vomiting, and weight gain. Serious side effects: seizures, changes in vision, swelling of arms, feet, ankle, or lower legs. Unusual involuntary movement of face or body, sore throat, fever, chills and other signs of infection. Very stiff muscles, excess sweating, fast or irregular heartbeat, rash that may occur with fever, swollen glands or swelling of the face. Skin redness or peeling, hives, difficulty breathing or swallowing. Don't decide right now. Don't act on your thoughts right now. The option of taking your life will always be there. This is another random thought that crosses your mind. Wait for another hour or a day. I promise your thought will change. Avoid drugs and alcohol. You will be tempted to take them, but don't. Fight it. They will take you along the wrong way, make you impulsive and cripple your problem-solving ability. Let it out. Let out your frustration. It's perfectly okay. Scream, cry it out, or write it down. Tell someone about your thoughts. In case they don't understand, it's absolutely okay. Don't let it discourage you. Call 112. They are eagerly waiting to help you. You are never alone. If you're waiting for a sign, this is it. Please don't kill yourself. Bring out the warrior in you. You're a fighter. You will not surrender to this random thought. You are stronger than that. Fight it, and I promise you'll be glad. Remember the things that you always wanted and are still possible. Fight for them. You will have to be alive to experience them. You won't let your story end on this note. You are a conqueror. Prove it. Feeling suicidal is never equal to being weak, unstable, or selfish. You are just a human being. It's okay, but it's not okay to act on it. Get help and help yourself. No one is immune to suicide or suicidal thoughts. It can happen to and when least expected. Use clues. Help a suicidal person by connecting with them. They want to be seen. Listen to them. They want to be heard. Understand them. Express concern. They want to feel loved and needed. Seek help if things get out of control. Remember, your friend's life is more important than his or her pride. Always be there and be an active listener. That's all they want.
With family and friends, you'll never be alone again. With love till the end, you'll ever be a lucky man. There's always something in the air, always something new. But there's nothing out there that can compare to the love that's made for you. Whenever you're broke or full of questions, a practical joke stabbing like a knife, just try to see that this is only happening to show you what's the purpose in life. With family and friends, you'll never be alone again. With love till the end, you'll ever be a lucky man. There's always something in the air, always something new. But there's nothing out there that can compare to the love that's made for you. It's like a whisper in the night. Just try to see and catch the light.